All right, Matt. So I'm Walker Lenz. I'm going to be your student physical therapist today. And today we're going to be performing a little, it's called a mobilization with movement. So basically what that's going to be is I'm going to have you pick your arm up right here just like this when I tell you. And what we're going to do is you're just going to punch right towards the sky. Well, I'm going to have one of my arms on your shoulder, okay? And the other one's going to be right on your back. So if that's all right with you, we can go ahead and continue.
Yeah.
All right, awesome. So what we're gonna do is we're gonna be doing on this shoulder today. So what I'm gonna have you do is I'm gonna have you bend your elbow up like this. That one. I'm gonna have you bend your elbow up like that. And then, so I'm going to apply a posterior lateral glide here. And I'm going to be cupping his inferior border here. All right, Matt, and I'm gonna have you keep your elbow right in here like this, and then when I tell you, you're just gonna punch your fist right up towards the sky, and then we're gonna come back down when I say, all right? So I'm gonna go ahead and apply that posterior lateral glide, cupping that inferior border, and we're just gonna stabilize that and let it glide into that upward rotation. So go ahead and punch up towards the sky there. So we're posterior lateral, transferring to an inferior glide there as we're facilitating that scapular upward rotation and come back down. Good. We'll go ahead and do 2 more of those. Good. And 1 more. And back down. Perfect. For the arm trunk elevation technique, first you want to rule out, make sure there's no shoulder cuff pathologies. You could do a drop arm test or do MMTs with internal and external rotation to make sure everything is sound there. You could also, make sure this is an appropriate treatment by doing a McClure's test or a scapular assist test, which is the one that I prefer, just seeing if the assistance of the scapula upward rotating is decreasing the patient's concordant sign and allowing for more range of motion. This mobilization is to increase the arm trunk elevation past 150 degrees, and you want to aim to reduce the patient's concordant sign by gliding the humeral head back over the glenoid and increasing its congruency. You can also do this for 6 to 10 repetitions and anywhere from 2 to 3 sets per treatment. And you want this to reassess the patient's arm's movement by just having them do an overhead raise of their arm and seeing if this increased their range of motion. And you could reinforce this technique with wall-wise with a Therex band and doing flexion overhead. All right. So Matt, I'm Walker Lenz. I am going to be your student physical therapist today. So what we're going to be working on today is an upper spine movement technique. So what that's going to do is it's just going to allow your spine to have a little bit more motion, which should also help with raising your arm above your head. So if it's all right with you, this is going to involve me putting one hand behind your back today and one hand under your arms. So if that's all right with you, we can go ahead and get started. Yeah. Awesome. All right, so first things first, I'm gonna have you sit all the way back in that chair with your butt, perfect. And then I want you to sit nice and tall with me for your back, awesome. All right, so now what we're gonna do is bring our arms up and interlock our fingers right behind our neck, perfect. So what that's going to do is that's gonna protract our scapulas here, and it's gonna stabilize our cervical spine. So what that's gonna do is just stabilize you a little bit so we can help get that movement there. So go ahead, bend your neck down a little bit for me. All right, good, I'll find C7 and look back forward. So what I'm gonna do is walk down right to T2. Place my thenar eminence along that spinous process, and I'm gonna reach my other arm under here, under your elbows. And now Matt, when I start applying a pressure to your back, what I want you to do is raise your elbows right towards the ceiling for me, all right? Okay. So what I'm gonna do is apply an anterior superior direction on that T2 spinous process. We'll go up, hold for 2 seconds, and we'll come back down. Good. Again. And back down. We'll do one more. Doing all right? Yep. And back down. Perfect. All right, so what we would do for that is we would do about 10 to 15 repetitions regularly. And then after that, we would go ahead and reassess the thoracic mobility and go from there. For the thoracic mobilization, first you want to clear the spine, making sure that there's nothing that's going to interfere with the mobilization. Make sure that the patient doesn't have any recent fractures, history of cancer, severe osteoporosis, or any spinal instabilities that could pose a problem, or any recent spinal surgeries, and making sure that they don't have any recent incisions or open wounds that are present. In order to target the thoracic spine specifically, you want to make sure that the patient is locked out in their lumbar spine or in neutral, making sure that there's no slouching or anything like that, making sure that they're all the way against the chair. You also want to make sure that there's no shoulder lesions going on because of the position that the shoulder is in. So you want to make sure that there's no rotator cuff instabilities or rotator cuff tears present. You can do that with a couple tests, a drop arm test specifically. Again, making sure that they have had no recent surgeries, or making sure that the articular positions of the shoulder are all intact and good. You want to make sure that the range of motion that is needed for this mobilization is pain-free, making sure not to cause any increase in pain in the shoulders, for example. And you also want to make sure that you're doing this for hypomobility of the thoracic spine. As far as dosing, you can do anywhere from 3 to 5 sets, 10 to 15 repetitions, holding for 2 seconds at the top. To reassess after doing the mobilization, you can use the SFMA breakout 1, making sure that they're getting 50 degrees of thoracic rotation and trying to get the acromions in line. You can also do the manubrium test. And self-mobilization that they can do to reinforce this is placing a towel roll horizontally along the top of the chair, assuming that same position, and then leaning back up against it. All right, Matt, I'm Walker. I'm going to be your student physical therapist today. So what we're going to be doing today is we're just going to be doing a taping technique on your shoulder here. So what this is going to do is it's going to help correct the movement of your shoulder and the place that it is naturally sitting, so that you can have some better movement, and hopefully it'll reduce your pain a little bit. So if that's all right with you, we can go ahead and start that.
Yeah.
All right, so I just have some athletic tape here today. The first strip that I'm going to place down would be kind of like our base layer, and then the second strip, I would prefer Leuco tape, but I don't have any. Yeah. So what we're going to be doing here is we're going to be coming just beneath the acromion, right about at the greater tubercle region. Going to be placing that there and coming around. And Matt, go ahead and twist right for me a little bit, your upper body. So what I'm going to be doing is ending that tape right under the spine of the scapula here. And what that's going to do is that's just going to give me a good anchor so that we can move his humerus posteriorly, because it's now sitting in that anterior location. So what I'm going to do now is, like I said before, this second layer would preferably be the Leuco tape to give a little bit better resistance on his shoulder. So I'm just going to measure. I want it to be about a quarter of all the way to the spine to the scap. So now that I don't mess up the tape. All right, so what I'm going to do is I'm going to first anchor that first piece right over that first piece that was put down. I'm going to bring this back, and what I'm going to do is stabilize the scap there. Stabilize the scap here, provide a little bit of a posterior glide there, and then I'm just going to anchor that tape right along the scapula there, just beneath the spine. What that's going to do is give us a little bit of a posterior glide there, so you can see the tape there. Coming back around under the acromion and anchoring onto the spine of the scapula. For the anterior femoral head taping technique, you want to make sure that there's no rotator cuff pathologies. You can do this using a drop arm test or a Hawkins-Kennedy test. You can take a patient's history to make sure that they haven't had any prior injuries. Also, you want to check to make sure that this tape isn't going to cause them any skin irritation, or they don't have any previous skin irritation in the area. You can use a McClure's test or a scapular assist test to make sure that the scapula isn't a reason for the anterior translation or the of the humeral head. We're doing this to promote a more neutral position of the humeral head and increase the posterior support of the rotator cuff. To do this, you can make sure that there's no labral pathology as well with a biceps load 2 test. Again, what we're doing is trying to reposition the humeral head in a more neutral position over the glenoid and increase its congruency. Reassess the shoulder elevation just to make sure that the taping technique is effective. And you can use eccentric and concentric external rotation exercises to promote the tone of the infraspinatus to make sure that it can help glide the humeral head more posterior over the glenoid.